Thank you, Sarah, for that introduction, and welcome once again to everyone out there who's watching this webinar. This is Building More Authentic and Genuine Relationships with Students. My name is Mr. K, John Kronstein. I'm a school counselor in Charlottesville City Schools. And so with that, let's get rolling with our webinar for today. So what are our learning intentions? What are we hoping to accomplish? Well, the first thing we're going to do is look at the difference between being authentic and being genuine with children, with kids, our students, and why it matters when it comes to building relationships. We're also going to do a bit of self-reflection about the particular barriers keeping you, the person who's here, from actually building those genuine and authentic and positive relationships with kids. And then lastly, the ability to use data to guide and inform who you are intentionally seeking out from the beginning of a school year, 9 weeks or semester. So we not only want to look at equity issues and disparities, but we also want to reflect on who we're actually reaching and why. Who are we not reaching? So let's start out with acknowledging and affirming who you are. You are mental health rock stars in your schools. You are part of a team that is doing incredible work with kids, and that can't be understated. So you need to make sure to give yourself a pat on the back when it comes to these building relationships. At first, you may be watching and saying, no, I know how to build a relationship with kids. But stick with me. Hopefully there's something today that you take that's new, that's unique, that maybe challenges some of your own personal beliefs about how you build relationships with kids, and seek to grow, right? Some of you have been in your profession for 10 years, 20 years, 30 years. Some of you are brand new and just getting started, but either way, we all have something to learn, and we can all grow from where we currently are in order to build better and stronger and more genuine and authentic relationships with our students. So our time together, what's it going to look like today? We looked at those intentions from the beginning. What are we hoping to learn? But what are we going to spend our time doing? We're going to start with position statements. I don't know, it may sound a little nerdy, but I really like to look at what do our various associations say about relationships during this pandemic time that we're in. We're also going to talk about what does it mean to have a positive relationship. We're going to look at some of the hows. We don't really break down a lot the hows of forming relationships, but I think that's very important. What are the barriers to building positive relationships? We can sometimes be anecdotal with these and look at some of our own experiences, but a lot of times in schools, we're the ones who are tasked with helping adults with those relationships as well. We help kids with those relationships all the time, right? But sometimes it's also the other adults in the building. We need to be able to give some action steps or some clearly defined hows in terms of building those positive, genuine, and authentic relationships. And then we're also going to talk about barriers to building positive relationships. And that may be a little hard for us because I'm going to ask you to take a really hard look at yourself, at your practice, at the kids that you think you're reaching, and really dig down to say, well, am I actually reaching those kids, and who am I not reaching at all? And that leads us to the how do you know? How do you know you actually have a positive relationship with the student? How do you know that you have genuine and authentic relationships with all kids in the school? Or do you? Or is that even possible? We're going to talk about that. So let's start with my school counselors in the building. So school counselors working in a virtual setting provide a school counseling program through the use of technology and distance counseling with the same standards and adherence to ethics as school counselors working in a traditional school setting. School counselors work collaboratively with all stakeholders to ensure equity, access, and success of all students, whether virtual school counseling is offered synchronously or asynchronously. Now, this position statement is from 2017, so it's not very, it's not been updated during COVID and during the pandemic. But why I thought this was important is our professional association as school counselors is saying you provide the same level of care and under the same ethical adherences and guidelines virtually as you would in person. And that's important to think about. A lot of us watching right now are in either hybrid models or fully virtual models during the school year. Not a lot of us are in fully in person. But you may, even if you are in person at some point this year, you may go virtual. And so it's important to start thinking about what is school counseling or any of the other professions watching, what is school social work, what is nursing, what is school psychology look like in this digital environment. So let's look at some of the other professions. So this comes from the National Association of School Psychologists. Because students, families, and our colleagues need support during this time, and because we cannot be physically present with them to provide such supports, we are obligated to figure out how to best provide support within the limitations imposed by the COVID-19 crisis. I like that. We are obligated to figure out how to best provide support. Because every situation is different, it is important to have an ethical, equity, and preventative lens. And that's talking about in regards to scope and practice. And that's from one of their briefs about telehealth, especially virtual service delivery, updated recommendations for school psychologists. But I think, again, hopefully those of us in the other professions are reading some of these and looking at, wow, I really need to go back to the drawing board a little bit, or maybe this affirms some of the work you're thinking about doing already, which is fantastic. These are for our school social workers. This is from the School Social Work Association of America. Most of us are accustomed to doing most, if not all, of our work face-to-face with our students. This crisis situation may necessitate that we provide school social work services through new delivery mechanisms or via asynchronous communication. And that's important to remember. This pandemic may be completely breaking any idea of how we thought we engage or build relationship with students, especially if you're working at a school. Well, all of us work at schools with new students coming in, students we've never met, families we've never met. If you're at a transition point, right? I mean, you're talking about students who are moving from one building to another who didn't have any of those closure activities or pieces that they needed to end their school year. And that's a loss, right? We used to refer to a lot of that as disenfranchised loss, this grief that comes with a loss that's not really recognized by the broader world and society. And lastly, for our school nurses, the National Association of School Nurses says this: building a relationship of trust is of paramount importance. And this is how they do it. The virtual atmosphere and different contexts from which they are used to interacting with the nurses may be stressful for the student. I really like that the School Nurse Association actually said this. And here's some suggestions they gave. Speak in a calm, reassuring voice and explain what will be happening in age-appropriate language. Make eye contact via the camera. And if you need to look away from the camera, explain what you will be doing. Engage younger students with small stuffed animals on camera, reading a book, singing, or deep breathing. Older students may like jokes or riddles. You know, it's interesting. The School Nurse Association, the National Association for School Nurses, was one of the only ones that gave practical steps within their guidelines. And it was phenomenal. And you think about that and you're like, well, but I knew that. But I didn't think about if my eyes go off the camera, I should explain to students or even you if we're here right now what we're doing. So I'm going to take a moment and do that, right? Let me practice what I'm preaching here. And I'm trying to build a relationship with you asynchronously because you're going to be watching this at various times. So sometimes I'm going to look down because I have a timer right below me, watching the time. So this doesn't turn into an 8-hour webinar of just me telling stories and talking. And I also have my notes down here. So if I look down, that's probably what I'm doing. I'm also in my office right now at school, and while there's only a couple of us here, no students, there may be noises outside or somebody may knock on the door or something, and I'll try to pause the video when that happens. But wow, talk about building context from our school nurses. And I think that's why this is so important to read these position statements sometimes, is because the various associations and then how we work together is so important. You know, we really need to be coordinated in how we're working with students. To be frank, as a school counselor, I wasn't thinking about how am I going to be engaging with our school nurse during this time of pandemic and virtual learning to make sure our students and families have access to everything they may need. But reading this position statement completely took me back and said, well, hold on a second. This is another member of our team. This is another adult who sees, I don't know how many students in a day. Think about how many students and families our nurses interact with and who they feel comfortable talking to because of that medical lens that they come from. So our school nurses will definitely be a vital part of that team. All right. So we read a lot of position statements. Again, I always like referencing that because this is not just counseling or psychology or social work or nursing according to Mr. K. This is what our professional associations say we should be doing. So what is a positive relationship, right? What are we talking about? Well, first of all, it starts with you. You who's watching this webinar. You who's doing the work in schools. Well, what's the difference between being genuine and authentic? When we talk about being authentic, it's the self-expression. Being authentic means bringing your true self, being everything that you are, right? knowing who you are first, knowing what it is you bring into a space. What do you bring into your office, into your clinic, into your testing space, into your virtual space? What's surrounding you, not only um, metaphorically or philosophically, but physically, right? And then when we talk about being genuine, that's then how that looks, that self-expression looks towards another. So authenticity is all about bringing and being your true self. Being genuine is all about having true, deep caring and regard. If we go back to our Rogerian philosophy for our clinically trained mental health folks watching, but that positive regard that we have for one another. And being genuine, my hope is what all of us are striving to be. We're working with students and families in very vulnerable situations at all times, let alone now during the pandemic, and how we are genuine to another is so important, you know? And so how do you bring your true and authentic self is really important too. This is part of my truth, genuine and authentic self. When I go out into the communities, when I meet students for the first time, at a transition point, and even for the first week or two of school, this is the hat that I wear. This is me. People ask all the time, how do you know you're effective as a school counselor? Or how do you be more effective as a school counselor? And I first start with, it's a marketing tool. The kids know who you are. The kids want to know who you are. The families know who you are. And guess what? This hat has been with me for almost 6 years now as a school counselor. It's been on the news. It's been in the newspaper. It's been in all different kinds of things. And this is what families know. And so now when I walk around, oh, that's Mr. K. Oh, he's a school counselor. Oh, he's fun. All those kind of things. And it's being authentic to me too, because I feel perfectly comfortable like this. I like being fun and spontaneous. And that doesn't mean this has to be you, right? I'm not telling you to go out and buy a crazy hat or look for something, but it's all about making sure that you're bringing your true self and who you are. And if not, looking at that, right? Like, why do you feel like maybe there's not a safe space for you to do that as I take the hat off, right? And unfortunately, there may be other systemic barriers at your school or where you're at that's keeping in the way of you being your authentic and genuine self. And we'll talk about that. And then making sure that your office is a safe space, your clinic is a safe space. And that means safe space in terms of emotionally safe, physically safe, mentally safe. It means safe space in terms of hopefully you having done some work to help be an ally with our LGBTQ students. That safe space encompasses a number of different realms. But if students and families don't feel safe, and especially talking about building relationships with students, if they don't feel safe in your space to then be them true selves, which again, we're going to get to, then that relationship and the work that you really need to do and they really need to do is going to be hindered and may not be able to happen. All right. So we talked about the need to build a positive relationship, or what a positive relationship is or looks like, or the definition of genuine and authentic and all of those. But how do I do it? And my hope is maybe these are some practical suggestions you can give your staff as well. All right. So first of all, assume kids are the experts of themselves, right? Kids know who they are. Doesn't matter if they're 3 or 15. They know what they like. They can tell you why they like it or don't like it. They can tell you how they feel. Sometimes they don't have the full words, but they are in touch with their emotions a lot more than I think we give them credit for, right? You need to be your genuine and authentic self. I'm going to say that all the time, and spoiler or whatever, it's the title of this webinar, so that's important. You need to make sure that you are being authentic and knowing who you are in your self-expression and being genuine, having true care and positive regard for the person who's in sharing the space with you, that child, that young one, right? And bringing it to the table at all times. In doing so, and if you've created a safe space, you allow kids to be their genuine and authentic selves, because they can now, again, being the expert of themselves, they can teach you all of those things that are so important. Be interested in the things that they like and enjoy. And part of being genuine and authentic is not saying that you need to have this kind of fake presentation of, oh, I'm so into Minecraft too, or oh, slime, yeah, I really love building, making slime. But it's being interested in the things, and it's knowing those things. In the resources that you have access to, you're going to find a website called Common Sense Media. And what I like about that website is I'm not a person who plays video games, and I don't watch a lot of TV, so I don't know the latest TV shows and the latest video games and the latest movie crazes and things like that, or apps or websites that kids are using. Well, that's a repository of kind of the things that are new, and there are sections there for teachers to be able to access to look at, um, you know, what are the current apps and what do they do and what should parents be looking for and families be looking for when they're working with students to use those various different things. But truly be interested in what they like. Knowing your community is very important as well. I think it's important that you trying to figure out how do I say this open and honestly, right? This is me being my genuine and authentic self with you. But you have to know the spaces that your students live and play in, the spaces that your families engage with and in at all times. And I'm going to show you a map in a second that if I didn't know my community, it would be a thing, right? When I have a kid in my office and they're talking about, hey, what you do for the weekend, or what are you hoping to do for the summer, or what are some things around you as I'm helping them problem solve, maybe safe spaces for them to be when things maybe aren't great at home, or activities they can get involved in, or based on where they live, I know the supports around them in terms of, oh, well, Boys and Girls Club is actually within walking distance, or this computer tutoring group, or this music resource is kind of right down the road, or family is struggling. It's like, well, you know what, actually right around the corner, DSS isn't far to get to social services, right? So it's important to know the pieces of your community. And so also when they're in my room and they're talking about, oh, well, we went to this park and walked over here, and I can have a map I think it's super helpful to that. I can like ask about that. And I'm like, oh, I know that park. Like they have that awesome slide or that awesome, hill when it snows. I've slid down that and that was awesome. It's important to know those pieces of your community, because then your kids also feel like you have a genuine interest in the things they enjoy and the things that are relevant to their life. Where our kids play and hang out and socialize is relevant to their life and are big parts of their life right now. So you need to know your community. For instance, if you were in my community and in Charlottesville, and I do this with my interns whenever I have interns or show this to new staff all the time, this is a breakdown of our elementary school zones, right? So you're going to see the 6 different elementary schools that we have broken up. And we're doing a lot of equity work in Charlottesville City Schools. And so it's important for us to look at neighborhoods, and the dark blue areas that you see highlighted are high concentrations of Black populations above the city average, right? And so when you look at this and then you look at the elementary school distribution, well, yes, not only do I know that school there at the top in the north is not very diverse, but I know why. And the same with maybe that school there to the west. And then if I look at those schools above the railroad tracks, which is that dotted line in the middle, or below the railroad tracks, well, then I need to start asking, why is those railroad tracks there? Well, then I need to start asking, why are there certain neighborhoods there? And then I need to start asking, why were those elementary schools lines drawn in such a way where they were? If you look at some of the lines drawn up in that north and west and east pattern above the railroad tracks, those are some funky lines. Why were they drawn like that? What's going on in the community? And I think it's so important. If you don't know that, then especially when you're working with kids and they're talking about hurts or feelings that they have about certain things, if they're going to immediately know that you don't care at all about where they live or the history of what's going on, or you have no context for it, right? And so I think it's important to find maps like this, to find other maps, to know the history of the community that you're working in and possibly living in. It's important to know where your students and families are coming from, and not only where their students and families, but where their generations have come from in those neighborhoods, to best understand and begin working with and being genuine towards them, because you have a genuine care for. No, I hear you. Like, I know, like, that was a concentration, and they demolished all these housings and they built this public housing project, and that's why these schools are here. And they drew that line because this group of parents had a lot of money, and they said, no, we don't want students from that side or those students, right, to live here. And when you start to build more empathy for our students and really get to know who they are. All right, let's take a breath. You're right. You still with me? All right. We're going to talk about barriers now. What are the barriers in forming positive relationships with students? And this is where it can get a little hard because a lot of us operate off this kind of quote, right? But I'm a school counselor. I can build a relationship with any kid. I'm a school nurse. I'm a school psychologist. I'm a school social worker. I'm a teacher. I can build a relationship with any kid. And I want to challenge that right now. Because can you? So, what are some of the barriers maybe that get in the way? Our own implicit bias. Remember when I said we bring our full and true selves, or we should be bringing our full and true selves to our office, to our clinic at all times. With that comes these pieces that have been either ingrained in us, that we've learned along the way and maybe accepted, or these pieces that we haven't done the work on yet within ourselves that get in the way of the work that we're doing with kids. We have the belief or not belief that every kid is awesome. So there's some other things that may get in the way, right? The historical distrust of unfamiliar adults, let alone, again, as a school counselor, mental health workers. In certain communities, there is historical distrust of mental health, and there's a stigma. For some families, they teach kids, or they, because of different hurts or different ways of them wanting to keep the kids safe, not to talk to adults, not to trust adults. Trauma, big T or little t, institutional trauma, systemic, medical, psychological, various forms of trauma that may get in the way of that relationship, or maybe get in the way is not the right word. It could make it harder. It creates a barrier that you, as the adult, as the trusting adult, as the caring adult, have to figure out how to work around. Racial differences. In grad school, I looked a lot at the racial power dynamic in school counseling and the gender power dynamic in school counseling because I knew I wanted to work in an urban school, or I wanted to work in a very diverse school because it's what I grew up with. It's what I wanted for myself and my family. But the more and more I started to look at these two things about racial and gender differences and that power dynamic in school counseling, and I think it carries over, I know it carries over to the other mental health fields, and I imagine it carries over with the health field for our nurses, is that I have to recognize and own that as a white male, there's already a difference in the counseling office when the kids come in. And so we address that and we talk about it. I'm okay with talking about it. I'm okay with talking with kids about the race differences between myself and them, or the gender differences that are visible or not visible, right? And not assuming those pieces too is important. Sexuality differences. While there's nothing around me. Well, no, there's actually a lot around me. I take that back because I'm looking to my left and right and I see the pictures of my spouse and my kids. And so the artifacts that you have in your space that may or may not be putting up barriers. And I'm very intentional with how I put things in my office. Because my family is who I love and who I care about. And if I were to be denying that, that would not be bringing my true self. But I also recognize that right next to that, I have my safe space sticker and I have my ally pieces around to show that my students, so that my students know that just because I'm a cisgender heterosexual male, that I'm open and I'm an ally and I'm here for them. And I want to learn. Again, they're the experts of themselves to bring into the space that I want them, and hopefully they'll feel comfortable sharing with me. So a little bit more barriers when we talk about moving into the virtual world, right? A barrier is reaching every student. I don't know what your caseloads are like. If you're a school psychologist or a school social worker, I know right now your barriers are your numbers, your caseloads are huge. School counselors right now, you may have anywhere from 100 or less, maybe if you're at an alternative placement or a really small school, to 700, 800, maybe more. I'm going to have around 300 to 350 students this year. And that's a lot because I work in a school that has a lot of students with high needs and a lot of families with significant needs. And how am I going to reach and engage with every student? I know all of you watching are really worried about, our students right now in what's been going on over the past 5 months. We read the national statistics and the rise in calls to suicide hotlines, the rise in reports to social services for child protective services, the rise in the census at our state psychiatric hospitals and how they are overflowing and there's wait lists essentially. And so we're concerned, how are we going to reach every student? The difficult interactions virtually, right? The distractions. You're trying to talk to a kid and the little sibling or a dog barks or the internet goes out or family member walks in, right? So that's definitely a barrier. So those personal interactions are necessary. It's important for kids to feel like they have a personal interaction with some adult. And this is where we're going to have to get really creative with building relationships and where it can't just all be on us as the school counselor or the social worker, psychologist, or nurse. Feedback, right? Like a barrier sometimes in this virtual environment is we're not getting that immediate feedback from our students as to the work that we're doing with them. And so it's going to be key for us to figure out new ways to get feedback from them. The interactions have to be relevant. That goes back to that genuine piece, right? And allowing kids to be the experts of themselves. And are we seeing the true them? I don't know about you, but I feel like the number of webinars and Zoom and Google and insert other meetings that I've been on, I just stare at these blank faces from adults, let alone kids. And the sessions I had with kids when we went virtual back in the late spring, kids who would just have over the top, maybe that's kids who had just so much personality in my office. And I'm staring at them on the screen and it's just not the same kid. I said, who is this? And so, again, going back to that, when we have new students, we have students we've never met, when we have students who are at transition points, are we seeing the true them? And then access. Who has access and who doesn't? Who's following up with those students and families who we never see log in or show up to an office hour or a class meeting or anything like that? And then how are we addressing it? When we talk about barriers, a barrier continues to be a barrier unless we do something to address it. And it continues to be a word we just throw around and talk about a lot and are really good at defining the barriers. What we don't end up being really good at is exploring the solutions to how to break those barriers down. And that's going to be on you and your discussion questions to start figuring out, well, what are your barriers at your school and how am I going to break those down? And lastly, we're going to talk about the use of data, right? Because it's really important for us to know, how do we know that we're reaching every student? How are we keeping track of that? And is that in a learning management system, a student management system? Is that using some kind of confidential note keeping? Is that using a good old fashioned Google form or Google Sheet, spreadsheet, something for us to figure out who we're reaching? What kind of feedback do we want or need to seek? And how are we gathering that data, right? And I put that want or need because essentially what I'm saying is, what kind of feedback do you want? Because you can get whatever kind of feedback you want, but it's all about the questions you're asking, who you're asking, how often you're asking, and then what are you actually trying to get to? And then what are you going to do with that feedback? So if you're hearing from students that they don't feel like the lessons you're designing or the office hours or any kind of that, or any of those pieces are working, then you need to be able to hear that to then adapt your approach, right? The feedback about, well, you're doing office hours at a time that I can't do. I'm still asleep, right? I don't get up until later in the afternoon, or I'm not doing any of this until the evening. But you have said, as the school counselor and social worker, psychologist, and nurse, that you're only available between this time. I really think we're going to need to figure out, how do we reach students who are going to be accessing material in the evenings, on the weekends? And now, please don't hear that as we all need to be available 24/7, because a self-care piece comes into play there. But we at least need to be asking the question of our division and the people in our school of, the reality is there are a host of kids who are not going to be accessing any of this until after the school day. And then it's about the then, right? What is your data telling you? So you know who you're reaching, who are you not reaching, and why. I'll tell you an anecdotal story. So I went back and looked at all of the students who I've worked with last year, right? So 350 students, or all the students who were in my grade, excuse me. And I went through and just put a simple tally next to, yep, I could tell you more than one sentence about that kid. I could pick them out of a photo book, out of a yearbook without the names. I can tell you who that is, who that is. And I went through the list of my 300 and some students. And I got to about 51 students who I couldn't put a check mark next to. So that's one data point, right? There were 51 kids who I had no idea who they were. Or maybe take that back. I knew who they were, but I really couldn't tell you anything about them. I then started to break that down. Okay, almost every single one of those 51 were boys. Okay, so I looked at that. I broke it down again. Out of all of those, most of them were Hispanic boys, white boys, or ESL students. But I'm good at building relationships. I can build a relationship with any kid. So then I had to start asking myself the why. And we can come up with a lot of different answers. We can look at that back to that historical distrust. Well, Hispanic students are less likely to engage in the Hispanic population is less likely to engage in counseling services or seek them on their own. Maybe high academically achieving, especially white males, are less likely to seek counseling services on their own. Maybe. ESL students, do they even know what a counselor is? Maybe. The problem with all of that is that data shows me that I have to be more intentional with reaching out to certain groups of students. If I'm not intentional at making sure my ESL students know who I am, why I exist, how I'm here to help, are they ever going to reach out to me? Am I going to get to know them? Am I going to get to hear their stories and learn their needs and how I can best help and support them? The same with my Hispanic students. And then there's a lot of pieces, right? This is me being vulnerable more so than anything, is thinking about my white male students. What is it about? What implicit biases actually am I using against that group of students? And so your data tells a story, and you never collect data just to collect data. Your nurse visits. We look at clinic visits all the time, but now looking in this virtual world, how are you going to collect information on the families you're engaging with, or who are engaging with you and why not? So the last slide I'm going to leave is this, and I've gone a little over and I apologize. And this is how you can get a hold of me. I welcome questions. I welcome feedback. I welcome for you to say, I don't agree with any of what you just said, to help me as I'm continuing my growth in this, right? Because I had a big ego when it comes to building student relationships, that I can build a relationship with any kid, anywhere, anytime. And I'm pretty good. I'm pretty good at building a relationship with kids. But my data showed me there is a clear group of students that I'm not engaging. And you know what? I've never sought feedback from kids for them to tell me, yes, I have a positive relationship with Mr. K. Why not? Do I want to hear that information? I think so. But I need to self-reflect on that a little bit. I hope there's at least one thing you took from today's webinar that can be immediately applicable to your practice in schools. Remember, you're a rock star. You're doing phenomenal. Our kids are better because of you. Our kids need you. Our kids need us to be better. And so I hope you take some time, use the discussion questions, look at all the resources that have been compiled, and that you continue to grow in your own individual work about building more authentic and genuine relationships with students. Have a great day.